There is a theory that overactive bladder after COVID is caused by cytokines. Let me show you this article. It has not been deeply studied yet, but this is still in the hypothesis stage. So in this particular article released in 2020 in Medical Hypotheses, the COVID-19 inflammation results in urine cytokine elevation and causes COVID-19 associated cystitis. So viral cystitis. So cystitis is a non-bacterial infection, so it has increased urinary urgency, frequency, voiding at night. We know about all the normal symptoms of COVID with the cough and the loss of taste and all those changes, but they're beginning to pay attention to bladder symptoms. And so because of these genital urinary symptoms, the urinary urgency, they are now trying to figure out why. Is it an inflammation of the bladder mucosa? Is it cytokines? So they're going to talk about this COVID-19 Associated Cystitis, so CAC. We know that COVID is an inflammatory disorder and can be irritating to the bladder mucosa, but what they want to look at is the cytokines a big deal. And so they collected urine samples from people that had the CAC and found elevation of pro-inflammatory cytokines. It has previously been shown that patients with urinary incontinence and ulcerative interstitial cystitis, bladder pain syndrome have elevated urinary inflammatory cytokines compared to normal controls. So for this medical hypothesis, they hypothesized that people with the bladder pain from COVID would have a presentation with the same thing. They're saying that this is, COVID's an inflammatory disorder and it's going to release cytokines into the urine it is expressed from the bladder. They're going to test their hypothesis. Their implications for this study is they want the healthcare providers to know that bladder symptoms are part of COVID-19. They also want you to know that these bladder symptoms can happen, they hypothesize, in chronic long-haul COVID. They can have cystitis issues, and that is what we need you to remember. So they want you to know that the COVID-19 that you have got can give you bladder symptoms, and it can occur in patients who do not fully recover. In US, it can be an inflammatory disorder that's ongoing. So people need to know bladder symptoms do happen with long-haul COVID. Now let's take a look at this really cool figure that they have. This image kind of breaks it down. It says, okay, you get COVID, then you get systemic inflammation. Then that systemic inflammation doesn't leave your bladder out, and then you can have the CAC, which would be the overactive bladder version of COVID. And off to the side, release of inflammatory cytokines in urine.